Hello, everybody. Hello, and welcome to the High Risk Mondays. Hello, everybody. Welcome to the show. Welcome. Thank you, all of you logging in today. Thank you, Jackie Patel. Please just type in a hello. Say hi. If you're tuned in today and you're ready for a great session today, we're going to focus again on our high risk drugs. So the ultimate question: why are we focusing on the high risk drugs? Because if you look into your GPH framework, you will see in there that it says you're going to get at least one question from one group or from a high-risk drug. So it's very important. We do this every single Monday to help you, to make sure that we give you that confidence, that you understand, you get to know all the important things that the GPHC wants you to learn on high-risk drugs, with the whole aim is for you to pass this exam. So give me a special shout out. Hello to you, Yvette in the house. How's Eva doing today? Great to see you on the event. How's it going, Yvette? Franklin, always turning up, always dedicated. You've got to give a big respect to Franklin for coming here tonight, always on time. Nema Muno, how are you? Nema, great to see you. Nema. Hope you're doing great. Keshmesh, how are you, Keshmesh? Great to see you as well. Very interesting. Everyone is here, dedicated, determined to pass your exam. So every Thursdays we have a Q&A Thursday, and then on Monday, half an hour, we're going to smash this high-risk drugs, people. So if you're ready to have a good time tonight, if you're ready to learn all the high-risk drugs or some of the important high-risk drugs, please type a 1. And I'm going to give you the big reveal. So the reveal is I'm going to tell you exactly what high-risk drug we're going to cover today. So I said to you guys last time, I did not want to tell you what we're going to cover so that you could do some background reading, and then I could just surprise you with different high-risk drugs. So today is quite special because the high-risk drug which we're going to cover today, the reason why it's so important, why you must absolutely go through every single thing that I cover today, is because this specific high-risk drug is one of the most important ones. Why? Because it always comes up in the exam. You always get at least 1, 2, 3 questions on this specific high-risk drug. So it is a very important lecture. My aim is at the end of this, you will get more confident with this high-risk drug. You have more knowledge. You will know what sort of areas the GPH is going to test you on, so that once you get to the exam, you will indeed smash the exam. Teja, good to have you on there, Teja. Great to see all of you typing in once. Kwafo Mafo, how are you, Kwafo? Great stuff, people. So for today, the high-risk drug, wait for this. Big surprise, people. The high-risk drug for today is going to be the one I'm talking about, as the famous Methotrexate. Methotrexate. Now, if you look at the list, why is it so important? If you look at the list of high-risk drugs, can you guys, by the way, just type down some of the high-risk drugs from your list of high-risk drugs? I just want to see if everyone at least knows the high-risk drugs. So I'm going to tell you something about on this high-risk list that are specific drugs, because most of them are actually groups of drugs. So if you look at your GPH framework, you will see that most of them are groups. So things like NSAIDs are groups, opioids are groups, antihypertensives are groups of drugs. But there are 1, 2, or 3 drugs that they actually specify these drugs themselves. So non-therapeutic drugs, a list of them. So things like digoxin, carbamazepine, all of these fall under non-therapeutic drugs. But if you look at that list, you will see that there is insulin, there is valproate, and there is methotrexate. These 3 are on their own, right? While the other ones will fall under the groups, right? So all these drugs that you're putting down, like carbamazepine, amiodarone, lithium, and all of these are all correct under your high-risk drugs. Some of the drugs that you guys have put down fall under antihypertensives. But methotrexate is on its own, methotrexate. So that tells you quite a lot. That tells you that you have a high chance of getting a question, 1 or 2 or 3, in your exam on methotrexate. So for today, what we're going to do today is we're going to learn all the key things about methotrexate. I'm going to show you all the key areas where they could potentially ask you questions from. And whatever happens, please learn everything you can today. Go through this video a couple of times, because it's going to have vital information for you, key information that can make the difference between you passing or failing. So let's go straight into it with the questions. Let's do this. So all those drugs you've written down, all correct, they're all high-risk drugs. So we need to learn all of them, and we're going to do as many of them as we can every single Monday right here. For those of you who's here for the first time, if you're here for the first time, please type a 2, type a 2, type a 2. If you're on the high-risk drugs for the first time, today is your first time, type a 2. Most of your names, I recognize them, like Naya. Good to see you, Naya. So what we're going to do is I'm going to go through a couple of questions. I'm going to ask you. It's quite interactive. If you're here for the first time, all my sessions are very interactive. And the whole idea is that you learn, you participate, you put down answers, and then we can smash it together. So especially a big up to Kwafo. Everyone, please just say hi to Kwafo. Just give Kwafo a big hi, a big hello, a big shout. Welcome, Kwafo, for being here for the first time on this show. And EH as well is here for the first time. Big up to you, EH. We are here as a family. Sujevin, great to see you. Sujevin, nice to see you as well. So let's go into the questions. Every single thing, the key things you need to know about methotrexate. The first question I'm going to ask you is, what is the mechanism of action of methotrexate? What is the mechanism of action? How does it act? How does it work? At least you need to have an idea. So what we guys say, what is the mechanism of action of methotrexate? What is it? What is it? So that's the first thing you need to learn about methotrexate. How does it act? How does it work? And that in itself could be a potential question. It could be one of your extended matching questions. So I'm getting very good answers. So you are all on it. You are all on it. Inaya says folate antagonist. Absolutely correct. Inaya's going for it. Teja says dihydrofolate reductase inhibitor. Even better. Even better. Great words. So the first thing you need to know, by the way, if you don't know an answer to any question, please type a 0. Because when you type a 0, guess what? I'm going to dedicate myself to help you. Okay, this is to help you, not me, you. There are no slides on here. I know questions, I cannot see the slides. There'll be no slides. I cannot get the slides on. But I'm just going to go through the information. You're going to see the answers, and I'll show you the answers. So the first thing is, you need to know the mechanism of action. So the mechanism of action of methotrexate is an antifolate. Does anyone know any other drug that is an antifolate? It's so important that you know this. So methotrexate is an antifolate. It works by inhibiting an enzyme. The enzyme, you need to know the name of the enzyme, which is dihydrofolate reductase. And this is quite important. This enzyme is quite important in building your DNA. All right, so in the structure, maintaining that DNA structure. So it works on developing your purines and your pyrimidines. So all DNA stuff. So please learn that. So right, Yvette has put trimethoprim and Sherwood. How are you, Sherwood? Long time no see, Sherwood. Great to see you on there. So yes, so trimethoprim, methotrexate are one of the 2 most common antifolates that will get tested in your exam. They do come up quite a lot, these 2 drugs. So those of you on the combo course, at the moment, we are doing the infections chapter. And on Wednesday, we're going to start off with trimethoprim. So this will come up again. So it's very important that you know these 2 are antifolates. So well done, everyone. Very good. So next thing you need to know is the indication. What is methotrexate used for? Cotrimoxazole, that is correct as well. That's a combination of trimethoprim and antifungal. Great. So what is the indication? Give me some indications of methotrexate. Part of your revision, you're meant to know some of those indications. So what do you use methotrexate for? Part of your learning. So everything I'm going to show you guys today, I promise you 100%. If you get questions on methotrexate in the exam, those questions will come from what we're going to cover today. It will come from one of the things that we're going to touch on today. So the most popular one is coming out is RA, rheumatoid arthritis, correct. Immunosuppression, it's used for that. So you need to know the indications. What do you use methotrexate for? Yeah, so psoriasis, great stuff. Millie Hensley, how are you, Millie? Long time no see, Millie. Millie is absolutely correct. So you're looking at probably, when you look at psoriasis, what Millie's mentioned, yes, you do use methotrexate, but it's normally when all the other more like a last option. So absolutely correct. And Quacker, you know the score, Quacker. It is indeed also for severe Crohn's disease. So I generally look at those 3 main ones. I look at rheumatoid arthritis, Crohn's disease, and psoriasis, right? There's the three main ones. But obviously it's used as well, immunosuppression. That is actually correct. So great stuff. All of these are important for your exam. If you want to smash this exam, people, this is the right place to be. What are the doses? So you need to know some doses. Remember, all your high-risk drugs, all of them, those are, because people always ask me, Marvin, what doses do we need to learn? What side effects? There's so many in the BNF. And it is true that there are many drugs. But what I do say is that make sure at least you learn the doses of majority of your high-risk drugs. Right? So there's quite a lot of high-risk drugs. So if I talk about antihypertensive, there's so many of them. But the key ones, so methotrexate is worth learning at least a few doses. So if I ask you, for instance, what is the dose for Crohn's disease, right? Methotrexate in Crohn's disease, what dose do you use? That's quite important, absolutely important. So Crohn's disease normally between 10 to 25 milligrams once a week. Rheumatoid arthritis, you're looking at 7.5 once a week. And then severe psoriasis is about, I can't remember what that is. That's normally a specialist area. But the maximum dose for severe psoriasis is 30 milligrams. Right? So just a bit of information, look at your doses. The other drugs that I will say that the doses are even more important than learning the dose of methotrexate, but at least it's worth just knowing some of the doses. Now, next I'm going to ask you is probably one of the most important questions when it comes to methotrexate, which I know that most of you know already. Okay, so the question is important safety information. What is the most important safety information around methotrexate, which everyone talks about? What is the risk with methotrexate? What is the risk, the greatest risk with methotrexate? I'm not talking about side effects, important safety information. What is the most important safety information on methotrexate? So if you're going to advise patients, what is the one thing everyone talks about methotrexate? What do you have to be careful for? Thank you, Janki Patel. Janki Patel in the house. Janki Patel has smashed that. Janki Patel, let's put Janki's answer right there. So weekly dosing. Weekly dosing. This is your important safety information. So there's a very high risk, and there's been a lot of literature, a lot of resources are going out for this. The one thing you need to always remember is that methotrexate is one of those drugs that you give once a week. Unless sometimes if you're using it to treat cancers, then you could give it more than once a week. But generally for non-cancer conditions, which is the majority of them, what drug do you give to reduce the side effects of methotrexate? What drug do you give to reduce the side effects of methotrexate? People, what drugs? Nema, that's correct, once a week. So once a weekly dose is important safety information, because in the past, many patients have taken this drug every single day. So it's important that you know it's once a week. And folic acid. So folic acid and methotrexate should not be given on the same day, right? Should not be given on the same day. So a good way to remember that is Monday, M for methotrexate, Mondays, and F for folic acid Fridays, right? So Monday, M methotrexate on Monday, folic acid F on Fridays. That's a good way. Good memory trick to remember what days to give them. It doesn't have to be those days, as long as you don't give them on the same day, that's fine. All right. Great stuff, great answers. All of these points are absolute key when you're learning about methotrexate, and you'll get them in your exam. Great. So many important information I'm going to tell you about methotrexate. So the most important thing when it comes to safety is that this you're trying to avoid patients taking this every single day. So what are some of the things that you have to tell them, because you need to know this? What are some of the things or the measures in place in order to avoid overdosing of methotrexate? What are the things that you have to do, or what's in place, or protocols to prevent an overdose of methotrexate? What are the things that are there? What actions you have to take? What do you have to communicate? What has to be done to reduce the risk? Let's see your answers. Let's see your answers. So in pharmacy at the moment, you guys are all lovely. You're all great. Foundation year pharmacists, trainee pharmacists, dispensing methotrexate. What information? What has to be done to reduce? What are the measures, the things that will reduce the risk of a patient taking methotrexate every single day? Real power, like I've got real power in the house. Real power. Have a booklet, great stuff. Ensure the patient understands. So very, very important points. So please remember these points will come up in your exam. The first thing is the moment you dispense this medication, you have to explain the frequency and the dose to the patient or to the carer. So frequency is normally what we're talking about. It's once a week. Okay, so you have to tell the patient once a week. Second thing is you need to tell them the dose of methotrexate. So normally you can only prescribe one dose, one strength, which is 2.5 milligrams. So if that patient is taking, I don't know, 5 milligrams, 2 tablets, 3 tablets, right, once a day, you will have to tell them the frequency every single day or overdosing. Okay. Another thing you need to do is explain to the patients the reason why they're taking methotrexate in the first place. You have to tell the patient the reason, and then also the reason of taking other drugs. For example, folic acid. So you have to explain to them the reason why they're taking methotrexate, and then also tell them the reason why they're taking folic acid, for example. And also remember, one on Monday, one on Friday. For example, those have to be those days, but just not on the same days for methotrexate and folic acid. There's also a requirement that all the prescriptions and dispensing labels have to clearly show dose and frequency. So dose and frequency, absolutely key when it comes to methotrexate. You have to tell the patient about the dose. You have to tell the patient about the frequency. Then the last part is you also have to inform them, which you guys have written some of these things down. You have to tell them about certain signs and symptoms to watch out for, such as signs of blood disorder, signs of liver disorder, signs of respiratory side effects. You have to tell them all of this. So very important points I just mentioned there for you. Absolutely key. Absolutely key. Make sure you learn this stuff if you want to pass this exam. What points I've got? So Nema says methotrexate booklet, good counseling, and how to notice the side effects. Absolutely correct. Great stuff, Nena. Let's see. Inaya says only one strength of tablets dispensed. Correct. And that strength is 2.5 milligram tablets. If you do not know that, please learn that. Miriam Khan, how's Miriam doing? Big up to you, Miriam Khan in the house. 2.5 milligrams. Absolutely correct. Correct. Isn't overdosing, Millie Hemsley, isn't overdosing methotrexate for use in non-cancer treatment a never event? It is. It is. So the main thing about it is most of these things that we talk about, methotrexate once a day, we're looking at non-cancer treatments. Okay, so generally with yes, cancer treatments, sometimes you have it more than once weekly. Okay, but yes, this is what we call a never event, right? It's quite serious. And it's there to prevent the risk of an overdose, yes, of methotrexate. So all these ideas, all these things we're going through, absolutely important. Dose of methotrexate for the use in non-cancer treatment and never event, correct. So what else do we have? All your answers, great answers, by the way. I'm putting those answers up so that once you're going through revising, when you're watching this video, look at some of these answers that everyone is typing down. Absolutely important. Seek medical help if any reactions, correct. Correct. What else do we have? Proper labeling from Anne Morgan. How are you, Anne? I need to give a special shout out to everyone for being here because I respect that you've taken some time out to be here. So great to see all of you. Write a dose on outer package of methotrexate. Extra things to do from Janki Patel. A piece of paper for the patient, the dose, the time, all of that, the days, right? You even put the day every Monday at this time. Take your methotrexate. Great. Please, this specific drug, I said to you, you will see this in your exam. I can promise you 120%. You will get questions in the exam on methotrexate, and it's going to be on one of these things we're looking at right now. So the next thing we're going to look at, people, great stuff. Some of this you guys have mentioned already. What are the cautions? What are the cautions? Cautions with methotrexate comes up along your exam, and that's generally what sort of things you have to look out for. What are the sort of side effects you have to look out for? I know some of you have mentioned some of them, but what are they? What are the main side effects you look out for with methotrexate? So even in terms of your monitoring, what are you looking out for? What are the side effects? I know you know. I know you know. What are the side effects? What are you looking for? Cautions. Liver toxicity from Inaya. Absolutely correct, Inaya. Absolutely correct. Tejas is blood counts. Correct. Diarrhea from Janky. Yes, I'll put that under GI toxicity. That is correct. And Millie, vomiting blood, tyrosine. Yes, those are all symptoms, very important symptoms. Blood disorders, liver toxicity. Great. Pneumonitis, Inaya, fantastic. That's under your respiratory toxicity. Correct. All of these are looking good. Looking good. Sore throat, show it. Show it. Yes, sore throat, you're correct. Show it. Show, you're always correct, isn't it? You're just like a genius from Kingston. Is it Kingston? It is Kingston, right? It is Kingston University. So, sore throats, yes, so signs of blood disorders. Again, examples, sore throats, okay? And signs of infections. Cold sores, all of this. Correct, Sarah. How is Sarah? How are you, Sarah? And Morgan, photosensitivity. Many people forget about this one. So I'm very happy that you mentioned that, Anne. Very good, photosensitivity. Great. So I'm going to summarize that for you. So the main ones, definitely, please listen to this. So important. If you ask you questions on Methotrexate, it will be on one of these. Photosensitivity, definitely. Bone marrow suppression, which you guys have mentioned. Blood disorders, right? White blood cells. GI toxicity, so things like diarrhea, correct. Liver toxicity, pulmonary toxicity, and then also at very high doses, when you give very high dose of methotrexate, then you have a risk of getting nephrotoxicity. Now, part of your exam, what they're going to do is they're going to test you to see if you know the signs and symptoms of all of these. So it may not just come as pulmonary toxicity. When we talk about, say, liver toxicity, what are the signs of liver toxicity? So you need to know that. Right? So nausea, vomiting, jaundice, rash, all of these are signs of liver toxicity. So you need to definitely know what they represent. Yes, Sherry, I was correct. Kingston. Great. So next thing, very important points. You are learning key points about methotrexate that always get tested in your exam. Next is about what about the contraception advice? Because we all know we have that triangle in the pharmacy, don't we? We all have that triangle. Everyone says, oh my God, methotrexate, no, don't touch it with your hands. Don't do not put it on that tray. So what is the contraception advice with methotrexate? You have to know this stuff. What do you say to women of childbearing age, or also women that are planning on conceiving? What is the advice? What is the advice? What is the contraception advice? Let's see. Very important. While I'm waiting for your answers to pop up, why don't I just drop you a track while I wait for your answer? Yes, and we're back again. I love that tune. How many of you love that song? How many of you, if you love that song, just type a 1. You know, when it comes up, I love using that because it just makes you want to learn, doesn't it? So how many of you just love that tune when you see those seconds coming down like, yes, go. So what we got? Avoid conception 6 months. I want to see figures. So great stuff. So 6 months, absolutely correct. Absolutely correct. I'll give you that. Yvette says avoid conception during and 6 months after treatment. Yvette, you couldn't be more right. Yvette, you couldn't be more right than that. So look at those answers. Yvette is correct. So you need to avoid, so when you're taking the medication, so once, say, if you're methotrexate, you need to be on contraception, right? You need to be on contraception. And then if you stop taking the drug, you don't just go like, all right, I'll stop methotrexate now. I'm ready. Let's go. No, let's go have a baby. No, you need to wait 6 months. Right? So you stop methotrexate today. Sorry, you can have a baby today. You can start trying for a baby today. You have to wait for another 6 months. Very important information. It is carcinogenic. And more teratogenic. I'll say yes. Great stuff. Great. I'm going lots of ones. So you guys love the track. Fantastic. It's not just me. Yvette says in both men and women. Absolutely correct. In both men and women. So even men, right? So you have to. So you can't say, oh, listen, I'm a man. It doesn't matter. I can start trying to have a baby from tomorrow, even though I stopped Methotrexate today. It doesn't matter. You have to wait 6 months while you're man or woman before you attempt to conceive. So what about pregnancy? Can a pregnant lady take methotrexate? Yes or no? Let me know. Can a pregnant lady? Would you dispense methotrexate to a pregnant lady? Yes or no? Let us see your answers. So ladies pregnant, comes to your farms, I'm pregnant, I'm 6 months pregnant, or do you go, oh gosh, take more methotrexate? No, Shelby says, absolutely not. Jackie says, no, it is teratogenic. Avoid it, Marvin, don't do that. All correct. So what about if she wasn't pregnant, she was breastfeeding? So, okay, I'm not pregnant, so it's cool. I'm just breastfeeding. Is that right? Can you give methotrexate to a breastfeeding lady? So all of these are important points that you need to learn. And I'm teaching as we go on. Contraindicated man like Franklin. Franklin the house. Franklin, you look so cool, by the way. Like when I look at you, I see that tie and I see that shirt. You just look like a president. Doesn't he look like a president, Franklin? I look at your photo. Doesn't he look like a president? When you see Franklin, what do you guys think? Doesn't he look like Obama? Great stuff. Great answer, Franklin. Absolutely correct. So you don't, for ladies that are breastfeeding, methotrexate actually goes into the breast milk. So because of that, we have to avoid methotrexate for ladies that are breastfeeding. So avoid it altogether. So next I want to see ask you, the GPs likes to ask you questions about tests that you do before taking drugs, like asking questions about monitoring. So what I want to ask you about is screening, right? You guys understand what I mean by screening? So before you start methotrexate, what do you need to check? So if the President Franklin, right? If President Franklin, oh, that's good, President Franklin. If President Franklin is going to start on methotrexate, what do we screen him for before we even think about putting the president on methotrexate? So FBCs, right? So your full blood count, yeah. So you check those blood cells, liver function, absolutely important before we even start the president on methotrexate. Blood count, VET, LFT, FBCs, very good. You guys are great. Considering the fact that I just surprised you with methotrexate, I didn't even give you methotrexate in advance so that you could do some pre-reading. I literally just surprised you, and you are giving me great answers. I'm very impressed with all of you. So yes, definitely. One of the things you want to do is you want to exclude pregnancy. Make sure that Franklin isn't pregnant. So make sure that the person isn't pregnant. That's the first thing. And then all the other answers you guys mentioned are correct. So blood count, kidneys, the liver. You need to test all of this before you start methotrexate. So what do you monitor? Monitoring parameters come up a lot in your exam. And some of the things you guys have mentioned. So what do you monitor, and do you know any time frames? Because sometimes the GPS is going to give you questions, not necessarily just on what you monitor, but also asking questions on the time frames, right? So how long do you monitor someone for when they start a medication? And then once they're stable, how often do you have to monitor them? So very important that when you're learning your monitoring parameters, if they have got maybe a certain time frame of initial monitoring, well. So Janki Patel, what was Janki saying? Every 2 to 3 months, and Thija says every 1 to 2 weeks. Interesting. Now we've got two answers. We've got the lovely Thija saying every 1 to 2 weeks, and the lovely Janki Patel saying every 2 to 3 months. So which one is which? Which one is the right answer? Yvette has sorted the problem. Yvette's like, forget this stuff. All of you guys arguing, I'm just going to smash it. I'm just going to make it easy because I'm going to give you a full answer, Marvin. I'm not going to give you half an answer. I'll give you a full answer. Yvette's answer is spot on. And both Thedra and Janki are both correct. So it's 1 to 2 weeks initially. Once the patient is stabilized or stable on methotrexate, then 2 to 3 months. All right. So very important you know that. So 1 to 2 weeks. And then once they're stable and it's all good, then it doesn't have to be that frequent anymore, 2 to 3 weeks. And then when you're monitoring as well, you need to tell them to report any signs of infection, any signs, sore throats, fever, malaise, some of those blood disorder symptoms. How many of you are learning today? If you're learning something new, you're like, wow, this is good, I'm learning, this is great. Hit the like button, right now. If you're learning stuff, you think this is great, hit the like button. I'm going to give you 5 seconds, more music, blast of music just for you to hit the like. Back again, people, back again. Thank you so much. Hit the like button if you're learning, if you're enjoying this today, if you're learning something new. This is how we learn. We learn with fun. So one of the biggest things that I try to do when it comes to learning, all of you that are my course, that have worked with me, that have seen my videos, I am all about having fun when you learn. Why? Because I believe that if you enjoy learning, then you have a high chance of remembering all the stuff and eventually passing your exam. So great stuff. So we're almost finishing the series of Methotrexate. So next thing I want to ask you guys that comes up in your exam, obviously, it's your patient care advice. Let's look at some interactions. What are some of the most important interactions when it comes to Methotrexate? Tell me one that stands out. One interaction in particular that stands out with Methotrexate. What comes to your mind? What's the first one we'll talk about? Important interactions. So just like all drugs, there are so many interactions, but passing this exam is all about learning smart. It's all about learning smart. It's not just learning hard. You don't want to take the whole BNF and learn everything, but you got to know the most important things that generally come up and what the GPC really wants from you. And that's what I specialize in. I specialize in analyzing and finding out the key things that you need to know. So most of you are writing that down already. NSAIDs. You're going to learn any interaction. All right? Or if you're going to learn any interaction with Methotrexate, you think, gosh, Marvin, there's so many interactions, just tell me one or two. One of the first ones I'm going to tell you NSAIDs, and then the second one I'm going to tell you trimethoprim. Right? So NSAIDs especially, the GPHC likes asking you questions where a prescription-only medication interacts with an OTC medication or with a PMED. I'm going to say that again slowly. The GPHC likes asking you questions where a prescription-only medication, such as Methotrexate, interacts with an over-the-counter medication or a P medication, such as NSAIDs, such as your ibuprofens, aspirin. So one of the interactions that you definitely need to learn is interaction between Methotrexate and NSAIDs, like aspirin, Methotrexate, NSAIDs like ibuprofen. Another one which Miriam has written down, which we spoke about, which is the antifolate, is definitely correct, trimethoprim. Interaction with trimethoprim, omeprazole as well is important. I would say definitely want to learn these ones, NSAIDs, especially because OTC ones you have over there, trimethoprim definitely. Yes, omeprazole as well. Great stuff. So patient care advice is important that you know. You guys have said most of the things, such as with the patients, you need to advise them about the signs and symptoms of blood disorders. So things like sore throats, bruising, mouth ulcers. Then you also have to tell them about the signs and symptoms of liver toxicity. So things like nausea, vomiting, abdominal pain, dark urine, then respiratory effects or shortness of breath. You have to tell them to avoid any OTC aspirin, OTC ibuprofen. You have to counsel them on the use of these medications with basically on how to use the medication. Methotrexate, we spoke about the dose, we spoke about the frequency. You have to provide them with treatment booklets or patient alert cards. Absolutely important. So these are the key points for you. Generally, most questions you will get will come from one of these things we've covered today. And I can promise you 200%, for all the years I've been doing this with students, I've helped so many succeed. So many succeed. And I can help you to succeed. I know that. And I think all of you have the capacity to pass. You have what it takes. The question is, are you going to do the work? It's not a question of capability, whether you can pass. It's a question of motivation. Will you pass? Will you do what you have to take to pass? And guess what? You will, because just the very fact that you're here today, this is the actions I'm talking about. It's spending that time, taking that extra 30 minutes a day to learn something which will be vital for your exam. So congratulations to all of you. I have nothing but respect for all of you who have turned up here today. I really appreciate you coming, and I promise you that this information will probably make a difference between a pass or a fail for some of you. Mimi says, you are so motivating. This is what I do. I'm here for you. I'm here to serve you. And I'm here to make sure that you not only enjoy your experience as a foundation year pharmacist, but that you eventually become one of the best pharmacists you can be. So generally, in life, most of us always think that when we achieve something, that's when we're going to be happy. So we say to ourselves, I'm going to be happy when I become a pharmacist. The most important part is not the thing itself, it's the journey to getting that thing. Okay, so your journey, your foundation year journey, this journey is the most important. And so rather than wait until you become a pharmacist to then be happy, start enjoying your way on the journey. That's why I try to make your learning fun. That's why we do all the sessions. That's why I said, let's go. Get in, Millie Hensley. Get in, Sherwin. Oh, yes. So that you remember that life could be fun. Enjoy, play hard, work hard. So thank you, all of you. I look forward to seeing you guys again. Thursday, I'm going to be here for Q&A. If you want to ask me any questions, come on here at the same time, 8 p.m. every Thursday, Q&A. And then back again, Monday, we are back again for a high-risk drug. Yes, you know the rest. Spread the message. Thank you all so much, and enjoy the rest of the week. Back to the music, and I'll see you guys very soon.